For patients, the fight against breast cancer is tough, even with support from friends and family around.
In tonight's Health Watch, Local 5 Chelly Boutott tells us that there's a support group that can help.
Aurora BayCare Medical Center has 2 breast cancer support groups. One is a large group setting that includes providers, survivors, and their families. The other is more intimate to help survivors heal by connecting with each other.
I actually had a series of dreams 3 nights in a row that I had breast cancer.
That nightmare came true. And Karjala-Dobbins was diagnosed with breast cancer in 2012.
When I first got the diagnosis, they were my first thought, leaving my kids, leaving my husband.
Anne is now cancer-free, but
anyone who's been touched by any difficult challenge will say it can make you feel like you are so completely alone, or you're the only one dealing with this.
With her background in counseling and psychology, Dr. William Owens, Medical Director of Breast Services at Aurora BayCare Medical Center, asked Anne to speak at a large breast cancer support group meeting.
I thought she would be a great candidate because she was fairly recent in her treatments. Her treatments were pretty intense, and yet she seemed to do extremely well.
It's very powerful also to feel like you're reaching out and assisting someone.
The large group setting helped Anne and also made her want to start a smaller, more intimate support group with no provider present, just survivors.
It's not enough just to be here and exist. We have to have a good quality of life, and I think groups are a really good way to reach out and do that for people.
They were more outspoken and more willing to open up in this smaller group.
Many of the women are at different points along their journey through breast cancer, so they can reach out and help each other. It helped Anne.
I feel more hopeful. I feel more reassured. There's something about being with other people who are surviving that makes you feel like, yeah, I'm going to survive too.
There are between 4 and 8 people in each session, which meets every other week. It's open to survivors and those going through treatment. To learn more, you can call Aurora BayCare or email healthwatch@aurorabaycare.com. And that's your Health Watch. I'm Chelly Boutott, Local 5 News.
Thanks, Chelly. In the past, treating an irregular heartbeat in kids meant substituting one health risk for another. But now a cutting-edge technique is making treatment a lot safer. That's tomorrow in Health Watch. Well, it's Packers-Vikings game night.
And Local 5's Ryan Rodig joins us with a preview in sports. Ryan.
Well, Tom and Aaron, the big talk coming in was, would Teddy Bridgewater play or would